What new research prevents antibiotic-resistant ear infections? Imagine a future where ear infections no longer threaten hearing health due to resistant bacteria. Recent research is making that a real possibility by exploring smarter ways to prevent and treat these stubborn infections. One major focus is on vaccines. For example, vaccines like Prevnar target specific strains of bacteria such as Streptococcus pneumoniae, which often cause ear infections. These vaccines have successfully reduced infections caused by those strains. But bacteria are clever and can change. New strains that are not covered by current vaccines are emerging and sometimes show increased resistance to antibiotics like penicillin. This shows the need to update vaccines regularly and keep a close on how bacteria evolve in ear infections. Another key area is responsible use of antibiotics. Overprescribing antibiotics for ear infections that are actually caused by viruses does more harm than good. Since many ear infections resolve on their own, avoiding unnecessary antibiotics helps prevent bacteria from developing resistance. This is called antibiotic stewardship, and it's crucial for keeping antibiotics effective for future infections. Scientists are also working on developing new antibiotics. Research suggests that introducing new drugs early or using combination therapies can slow down the development of resistance. Instead of waiting until older antibiotics fail, using these strategies can help keep resistant bacteria at bay, especially in stubborn ear infections. Advanced diagnostic tools are making a difference too. Procedures like tympanocentesis, where a small amount of fluid from the middle ear is sampled, allow doctors to identify exactly which bacteria are causing the infection and what antibiotics they are sensitive to. This targeted approach means fewer broad-spectrum antibiotics are used, which helps reduce resistance and ensures the right treatment is given. On a global scale, organizations like the World Health Organization are working hard to track resistant bacteria and promote research into new treatments. They prioritize creating effective antibiotics and making sure they are accessible worldwide. This coordinated effort is essential because resistant infections do not respect borders. Preventing resistant ear infections is especially important because if infections become chronic or severe, they can lead to hearing loss. Children are particularly vulnerable, and ongoing infections can damage the delicate structures of the ear. That's why these research efforts are so vital. They aim to keep infections manageable and protect hearing health. In summary, current research is focused on updating vaccines to cover new resistant strains, encouraging responsible antibiotic use, developing new drugs, improving diagnostic techniques, and fostering international cooperation. All these steps work together to prevent resistant ear infections and help preserve hearing for everyone. Remember, if you or your child have persistent ear issues, always consult a healthcare professional for personalized advice.